Bismillahirrahmanirrahim. Assalamu alaikum, ladies and gentlemen. I welcome you all to this session on dengue syndrome and its prevention. My name is Dr. Fuad Hamid Rai. Before we move forward, please go through the objectives of today's session. By the end of this session, the participants should know about all the important things related to dengue syndrome mentioned on this slide. You can go through it so that we can move forward. Aedes aegypti, the yellow fever mosquito, is a mosquito that can spread dengue fever, chikungunya, Zika fever, Mayaro, and yellow fever viruses and other disease agents. Talking a little bit about the history of dengue and its emergence and its outbreaks. The first recorded outbreak happened in Australia in 1897. A reoccurrence was noted in 1928 during an epidemic in Greece, and again for the third time in Taiwan in 1931. It was not long before it reached other Asian countries, including Pakistan, India, Indonesia, Maldives, Myanmar, Sri Lanka, and Thailand, as well as in Singapore, Cambodia, China, Laos, Malaysia, New Caledonia, Philippines, Vietnam, and Vietnam in the Western Pacific region. It was a Polish American scientist, Albert Sabin, who had been conducting advanced research into numerous diseases, including cancer, dengue fever, encephalitis, pneumonia, and sandfly fever, who isolated the dengue virus in 1944. The mosquito which spreads dengue is not the common mosquito which you see in this picture. We have been, this is the normal mosquito which we've been seeing around us, but the one which spreads dengue fever is a different one. The adult female Aedes aegypti mosquito is the one which spreads the dengue virus from an infected human being to a healthy human being. And the adult Aedes mosquitoes are distinguished from the other types of mosquitoes by their narrow and typically black body, unique pattern of light and dark scales on the abdomen and thorax, and altering light and dark bands on the legs. This mosquito, which you see in this picture, is a female Aedes aegypti which has fed on human blood. It has sucked human blood, and now you can see the blood in the body of the mosquito. Only the female Aedes aegypti mosquito feeds on blood. This is because they need the protein found in the blood to produce eggs. Male mosquitoes feed only on plant nectar. On average, a female Aedes mosquito can lay about 300 eggs during a lifespan of 14 to 21 days. Dengue is found in tropical and subtropical regions around the world, predominantly in urban and semi-urban areas. Each year, an estimated 390 million dengue infections occur around the world. Of these, around 500,000 cases develop into severe dengue or dengue hemorrhagic fever, a more severe form of the disease which results in up to 25,000 deaths annually worldwide. Is the dengue hemorrhagic fever, and that's each year. While talking about the transmission, dengue viruses are transmitted to humans through bites of infected female Aedes aegypti mosquitoes. The mosquito generally acquires the virus while feeding on the blood of an infected person. After the virus incubation for 8 to 10 days, an infected mosquito is capable during probing and blood feeding of transmitting the virus for the rest of its life. Infected female mosquito may also transmit the virus to the offspring by transovarial. It means via the eggs transmission. But the role of this in sustaining transmission of the virus to the humans has not yet been defined. This slide shows you how dengue is transmitted from an infected person to a healthy person. There are four distinct but closely related viruses that cause dengue. Recovery from infection by one provides lifelong immunity against that serotype but confirms only partial and transient protection against subsequent infection by the other three. There are three types of dengue fever: the classical dengue, the dengue hemorrhagic fever, and the dengue shock syndrome. All of these constitute the dengue syndrome. Talking about the signs and symptoms of dengue fever, the signs and symptoms are described in the following slides. Signs and symptoms of dengue fever can be seen in this slide. The presentation of signs and symptoms may vary in certain individuals. You can just go through this slide, which includes high fever, headache, muscle and joint pains, backache, pain behind the eyes, skin rash, bleeding from the nose, gums, vomiting, diarrhea. In severe cases, complications like bleeding can occur. Again, in this illustration, there are different symptoms which appear during the different phases of dengue fever, which is the febrile phase, then the critical phase, and then the recovery phase. All are described here. Dengue hemorrhagic fever is potentially a deadly complication that is characterized by high fever, often with enlargement of the liver, and the illness often begins with a sudden rise in temperature accompanied by facial flush and other flu like symptoms. The fever usually continues for 2 to 7 days and can be as high as 41 degrees centigrade, possibly with convulsions and other complications. Uh, Dengue shock syndrome is a syndrome due to the dengue virus that tends to affect children under 10, causing abdominal pain, hemorrhage, bleeding, circulatory collapse, known as also as dengue hemorrhagic fever. It starts abruptly with high continuous fever and headache, plus respiratory and intestinal symptoms with sore throat, cough, nausea, vomiting, abdominal pain. Shock occurs after 2 to 6 days with sudden collapse, cool, calming extremities, weak, thready pulse, and blueness around the mouth. There's bleeding with easy bruising, blood spots in the skin, spitting of blood, hematemesis, blood in the stool, melena, bleeding gums, and nose bleeds. Pneumonia and heart inflammation may be present. The mortality is appreciable, ranging from 6% onwards. Upwards, most deaths occur in children. Infants under the year of age 1 are especially at risk of death. It is also called Philippine or Southeast Asian hemorrhagic fever. A molecular testing, a PCR test that detects the presence of the virus itself, is generally considered the most reliable means of diagnosis. A positive IgM and IgG test for dengue antibodies detected in an initial blood sample mean that it is likely that the person became infected with dengue virus within the recent weeks. Then the IgM becomes undetectable 30 to 90 days after a primary infection, but earlier following reinfections, IgM by contrast remains detectable for over 60 years, and in the absence of symptoms is a useful indicator of past infection. In a person with symptoms, the detection of IgM is considered diagnostic. Treatment, there is no specific medication or treatment. We have to do symptomatic treatment, supportive and symptomatic treatment to prevent complications. Avoid aspirin as well as ibuprofen, since these can increase the risk of bleeding. Analgesics like paracetamol may be given. Then rest and plenty of fluids are also recommended. The patient needs to consult a physician. Even if you are not sure that it's dengue, it's best to consult a physician. A trip to the hospital is a must if vomiting and severe abdominal pain develop in the first 24 hours after the fever declines. And for dengue hemorrhagic fever, fluid replacement therapy is an option for treatment if the condition is detected early. However, this frequently requires hospitalization. We've already discussed that we need to avoid aspirin and ibuprofen. Full recovery often takes place within several weeks. Typical dengue is fatal in less than 1% of cases. The acute phase of the illness with fever and myalgia lasts about 1 to 2 weeks. Convalescence is accompanied by a feeling of weakness, and full recovery often takes several weeks. The case fatality ratio of dengue hemorrhagic fever averages about 5% worldwide, but it can be kept below 1% with proper clinical management. The risk of being bitten is highest during the early morning, several hours after daybreak, and in the late afternoon before sunset. However, mosquitoes may feed at any time during the day. Aedes mosquito typically lives indoors and are often found in dark, cool places such as closets, under beds, behind curtains, and in bathrooms. In addition to these, personal prevention is, of course, of prime importance. You can see the personal protective measures enlisted in this slide. You can go through it. And in addition to preventive measures mentioned in the screen, uh, includes wearing of full sleeves clothes and avoiding shorts and half sleeves apparel. In addition to these favored places mentioned here, it was noted that dengue larva was also found in air coolers and in wastewater compartments of water dispensers. Then dengue vaccine is a vaccine used to prevent dengue fever in humans as of 2019. One version is commonly available, known as CYD-TDV, and sold under the brand name uh, Dengvaxia, Dengvaxia. Although there is now a commercially available vaccine against dengue, prevention is still the most important step to reduce the risk of dengue infection. There are several ways of prevention: mosquito control by either larval control and adult mosquito control, reduce mosquito bites, especially during daylight hours. So, involvement of the community is very important. Community based programs need to be introduced, and in addition to involving the health officials, the non governmental organizations and the general public also need to be included in these community based programs. And the government has produced different information, education, communication materials in different languages, in local languages as well. Of course, these are for those who can read and write. So, with this last slide, we end today's session. I thank you all, and while concluding, I would like to remind you of a few points which we've discussed: that dengue is a mosquito borne viral infection. The virus responsible for causing dengue is called dengue virus. There are four dengue virus serotypes, meaning that it is possible to be infected four times. While many dengue virus infections produce only mild illness, dengue virus can cause an acute flu-like illness. Occasionally, this develops into a potentially lethal complication called severe dengue or dengue shock syndrome. Severe dengue is a leading cause of serious illness and death in some Asian and Latin American countries, and it requires management by medical professionals. There is no specific treatment for dengue. Severe dengue, early detection of disease, progression associated with severe dengue, and access to proper medical care lowers the fatality rates of severe dengue to below 1%. And then dengue is found in tropical and subtropical climates worldwide, mostly in urban and semi urban areas. The global incidence of dengue has grown dramatically in recent decades. About half of the world's population is now at risk. There are an estimated 100 to 400 million infections each year. And lastly, dengue prevention and control depends on effective vector control measures. Sustained community involvement can improve vector control efforts substantially, and that is one of the reasons why we focus on elimination of or eradication of larvae. Thank you very much.